Thank you. Thank you, Chairman Johnson, Ranking Member Peters, for considering my request to hold a hearing on conditions of migrant children at CBP facilities today and this critically important topic. It's vital that we work together to ensure the safety and well-being of children. So I want to thank you, Commissioner Morgan, Deputy Inspector General Costello, for your testimony, for your work, and your commitment to doing the right thing here. So I've asked last month for 3 needed reforms. I placed hold on 2 DHS nominees. I'm going to keep my hold in place until the facilities drastically improve. As you know, a couple weeks ago, we went down, we visited Donna, McAllen, and Ursula, saw the conditions of the detention centers holding migrant children. They are slightly better than what was reported weeks prior, and those facilities are still no place for children to stay for prolonged periods of time or really any amount of time. I've been advised by child welfare advocates from various nonprofit organizations that there are 3 immediate changes needed at CBP. 1, more medical professionals with pediatric experience at CBP facilities. 2, the hiring of trauma-informed child welfare professionals to ensure the best interests of the children are being met. And 3, providing NGO access to CBP facilities to assist with humanitarian efforts. Last week, I sent a letter to Secretary McAleenan outlining these needs, and in spite of the urgent situation at the border, I've yet to hear back from him. So I'm asking, in the interest of time, if you would answer these similar questions in yes or no fashion. So, Commissioner Morgan, who currently, well, this is not a yes or no, who currently screens children for illnesses or injury after apprehension by CBP? Is it a medically trained professional?
So we have a couple layers, ma'am, and I know quickly. So we have Border Patrol agents who, when they are first apprehended, do a first layer of screening, whether an EMT or advanced EMT. Once they get to the processing center or the place where they're going to be held, then they're also screened. The majority of the children right now are screened by a medical professional, such as a nurse practitioner.
Are they using standardized screening tools?
Yes, ma'am. The protocols are actually developed by a physician that we have at DHS that has designed those protocols with respect to medical standards in industry.
So they're taking vital signs such as body temperature, blood pressure, and heart rate?
Yes, ma'am, every single one, and they actually have a range of temperature. They file as part of the protocol. If it falls within that range, it means immediately transport to a hospital.
Do all CBP facilities have adequate working medical equipment for children?
No, all do not. We're doing it by flow and threat and need right now, but we are expanding that every single day. 7 of the 9 sectors have it, over 20 of the 70 stations have it, and every day we're putting more medical resources online.
Thank you.
Supplemental help.
If a child is found to be injured or sick, is there a process for them to receive additional evaluation by a healthcare professional?
Yes, we work with local EMS, local medical facilities as well. And again, based on those protocols, if the individual is showing meeting those standards, we transport them immediately to the hospital.
Do your medical professionals on site at those facilities walk into pods or cells to look for sick individuals who may be too young to voice their needs, unable to ask for help, or are too afraid to ask for medical attention?
So we do welfare checks. Whether each one of those welfare checks, they actually go into the holding facilities, I need some more fidelity on that, but there are welfare checks that are mandated by TEDS every 15 minutes.
And approximately how many more medical professionals with pediatric experience and child welfare professionals do you plan to hire?
Yeah, that's a good question. I would say I'm welcome to anyone that you just described that continue to work with us to help us come up with that strategy and end game. We're welcome to any ideas and suggestions, but those numbers are being worked right now, again, from the physician that DHS has as the overall medical coordinator, as well as other, I would say, healthcare provider associations.
I'm going to ask, is there pediatric mental health screening in detention?
Not at this time. And again, I would just say that I understand, but again, I want these children out of those, even the soft-sided facilities. I agree with you, ma'am. That's not where kids should be. I want them out of there as fast as possible to a more adequate environment.
So who's ensuring that very young children have their basic needs met, such as diaper changing, feeding, bathing, or brushing teeth?
So we actually have coordinators in every one of those facilities, and the Border Patrol and other agencies that are helping us are responsible for that. We actually have detailed logs that logs when someone is fed, whether they receive a hot meal, cold meal, how many times they receive a shower, and et cetera. We have detailed logs on that.
So you've expressed just now interest in working with me to make some things happen. So are you developing a policy to provide access for NGOs to CBP facilities to assist with these humanitarian efforts?
So what I can say is those have been ongoing discussions, and Senator, I'm absolutely willing to work with you to come up with a workable solution.
Because we do have people willing to come in to help alleviate some of this situation and provide comfort care specifically for
Yes,
children.
ma'am. What I can say, the 115, 116 of Congress, we've had over 100 CODELs, staff DELs, almost the same number. We've had countless numbers of IG reports and other access and reviews. So we're not shy away from
But
someone
we'd like to
coming in.
see NGOs have access, better access, to be sure they can evaluate children who oftentimes cannot express concern or express what's happening to them. So I'd like to be sure that we are able to do that and can work with you. I have people ready, willing, and able to come to your facilities.
Yes, ma'am.
I just have a short time left. I want to be sure that Senator Hassan talked about abuse. Can you talk a little bit about the process for migrants to safely report any abuse that they have and if they're aware of that?
Yes, again, from the start, they have the ability from the moment that they're apprehended to report anything. What we have found, though, is once that they leave Border Patrol custody, CBP custody, and they go to HSS specifically for the children, that's when we found that most of the reporting is being done after they leave our custody.
So they don't have, so they're not reporting there, they're reporting after they leave. And
That's what the statistics show, yes, ma'am.
to your knowledge, is there a confidential process there for them to report so they don't receive retaliation wherever they go in the future?
Yes, ma'am. It's hard to have that confidentiality when you're in a central processing center or the soft-sided Donna facility that you saw that's wide open. But we absolutely take every allegation seriously and do everything that we can to make sure that it's followed through, and we coordinate with the appropriate entity, whether it's the IG, CRCL, or any appropriate entity.
Where, do you have a specific place where the logs are kept once the information report abuse, once abuse is reported? Do you have a central location where that's kept so that NGOs or other places can take a look and see what's going on?
Yes, ma'am. So we have a joint information center. It's called the JIC. So anytime there's a complaint or alleged complaint that goes to the JIC, that OPR from CBP manages, and that database is kept.
So if NGOs want to come in and represent someone, there will be transparency with these records.
So there's some privacy concerns with that with respect to ongoing investigations, but I'd be more than happy to work with you offline to see where we can reach an appropriate compromise for transparency. But there are privacy concerns with respect to investigations.
Thank you.